Breaking news occurring right now in the House Appropriations Committee. The House Republicans are passing their health care bill, and this is it right here. So I would assert that they will not have a problem reading this bill because there's only 7 lines of substance on it. It is the intent of the General Assembly that health care delivery in the state result in improved patient outcomes, improved patient care, and reduced cost. It is the intent of the General Assembly that such health care delivery provide for the replacement of the Iowa Care program. That's it. We hope this is not the governor's plan, that it's something more than one paragraph. And I think they're trying to figure out, how do we have a bill that even remotely passes the laugh test? And that's why what we have before us is just a short document today. They're still working on these details because his plan, under his own language, costs more and covers less.
There's nothing there. I mean, the governor's announced already last July that he wasn't going to expand Medicaid, so he certainly has had plenty of time to try and flesh out some kind of a different or an alternative health insurance plan. I do know that the 2 chambers do agree on the provisions of the bill that we passed that created an entirely different delivery of health care, including the accountable care organizations, medical homes. All of those provisions are going to change how we deliver health care in our state. The sticking point is how they're going to pay for it. And even in conversations with leadership in the House, they have said that is a sticking point for them because, quite frankly, what little the governor has given to us so far is going to ask House Republicans to vote to raise property taxes to pay for the governor's plan. And they do not want to do that. We are trying to reform a mental health system and trying to reduce the burden on property taxes to pay for mental health. On the other hand, the governor's plan, at least what we saw a few weeks ago, the outline, was that he is going to actually ask county supervisors to raise property taxes for mental health services, as we're trying to move in the opposite direction. The governor's plan right now, the best we can tell, is going to ask Iowa taxpayers to pay $162 million, plus that would pull down $227 million in federal dollars to pay for his plan. On the other hand, Medicaid expansion has already been paid for through our federal taxes. The money is there, it's been budgeted, it's been allocated, and we also know that regardless of what people want to believe, we are, those of us who are fortunate enough right now to have health insurance, we are paying for the uninsured to some extent, to the tune of about an additional $1,000 a year in health insurance premiums. So it makes absolutely no sense that this legislative body cannot reach agreement to make sure every Iowan has access to health insurance.